Alagille syndrome is a genetic disease. About half of the time it's inherited, about half the time it's spontaneous. These are mutations in the JAG1 and Notch2 signaling pathway. So the background of the disease is that it's a multi-system disorder. Kids can have, a range of manifestations from cardiac to ocular and to liver. And importantly, those who have liver involvement have what we call cholestatic liver disease or cholestasis of the liver, which means they have an inability to move bile acids out of the liver into the gut. And for you and I, 95% of our bile acids get recycled daily. 5% go out in fecal excretion, and the rest of it is used to go around and around and digest foods, absorb fat-soluble vitamins and lipids. And for these kids, there is an inability of that bile acids to get out because they have a problem with the plumbing of the bile ducts. So they're basically either not there or they're malformed, and so bile acids can't get out. So when they get this increase in bile acid accumulation in the liver, it spills over into the blood system and they get systemic, or what we call serum bile acid increases. And this increase in serum bile acid drives liver damage because they're toxic to the liver. And most importantly, I think it really affects the symptomology. So they get this incredible debilitating pruritus. And by pruritus, I mean itching. And this is not an itch that's topical on top of the skin. It's an itch that these really, quite frankly, very little children, they can't get to it. And so they're scratching themselves to bits, really literally tearing their skin off. Parents describe that they wake up in the morning and they can smell blood on the sheets. Parents don't sleep. The family dynamics change considerably. Kids don't do well at school because they lack sleep. They're itching all day, all night. There's, just an unbelievable, really difficult stories to hear from families when they talk about their children with Alagille syndrome that have pruritus as a significant symptom. Treatment for this is, until now, has been really scant, and they use off-label therapies and topical agents that really doesn't get to the core of the pruritus and doesn't really help. So what they end up doing is giving a liver transplant for these children. So they get a liver transplantation for this pruritus. That's how bad it is. And then we know with liver transplantation, transplantation of any organ, frankly, comes with a lot of associated risk, morbidity, mortality, and lifelong immunosuppressive therapy. And physicians often describe it as trading one disease for another. So now what we have is Livmarli, which is approved for the treatment of cholestatic pruritus and Alagille syndrome in kids 1 year of age or older. And this has been, I think, a significant advancement where there's never been anything approved in this disease setting before. What we showed recently at a conference called the American Association Study of Liver Disease, or AASLD, that was recently held. We had a late-breaking presentation where we looked at survival, event-free survival, and these events being transplantation, death, liver decompensation, and surgical diversion. And we looked at these patients that were treated with Maralixibat or Livmarli compared to an untreated child from a natural history data registry. And we found that there's a 70% reduction in event-free survival, or 70% reduction of events in patients treated with Livmarli versus an untreated cohort. That is incredibly significant, and I think really actually makes quite a bit of sense, because if patients are getting transplanted for pruritus and you're improving serum bile acids and improving pruritus, then you're likely to see a change in the way that it's treated, in that they may not need to go to transplant. So that's the first thing. The second thing that I would also say is that we recently published a paper in the Lancet, and that's looking at pruritus improvement in and of itself, looking at serum bile acid improvement, looking at other manifestations of the disease, because these children also don't grow. They're usually significantly under the growth chart. And we looked at all of these kind of on a holistic view of what does it look like when a patient gets treated to past 4 years. And we see significant improvements in pruritus. So about 80% of, over 80% of patients have an improvement in pruritus within that year. And then beyond that, it's durable. These patients start to grow. They just have an overall improvement in their health.